Speakers at the 2025 Society of Critical Care Medicine in Orlando, Florida, made an announcement that I kind of been saying all along, except in this case, it was actually with ICU patients. And with those ICU patients, their announcement showed a 25 to 50% decrease in coma-related days, and as also a 50% decrease in readmissions to the ICU. What these speakers were from was the University of Vanderbilt in Nashville, Tennessee, and then in San Francisco, the University of California at the hospital in San Francisco. And what they did in a select group of patients is they got them up and moving while they were in the ICU. Of course, that's not going to work with everybody. As I said, these were select patients. They used nurses, they used physical therapists, they used family members in some situations to get them up and moving. And they found that it decreased the risk of confusion, delirium. It increased the muscle strength. It also, of course, as they're getting moving like that, it builds up their desire to heal and to get better. But this was kind of exciting. One of the pictures actually from the presentation showed a patient on a ventilator up and moving with a physical therapist, which was unbelievable to me. But it makes sense because all of my patients, when they go in for surgery, colonoscopies, shoulder surgery, hip surgery, knee surgery, I always recommend a lot of water and get up and moving as soon as possible, because you don't want your muscles to fade away by laying in bed for extended periods of time. Secondly, you need to get that anesthesia out as soon as possible because it causes things like confusion. It still keeps you sedated. So the more fluid that you can take in, the better, and the more you can move around. Obviously, with a hip or knee replacement, you cannot get up and walk around. But if you can do things to get your arms moving, to get your upper body moving, exercises that physical therapy can help you with, that the nursing staff can help you with, anything to get you moving, deep breathing, get that heart rate up and metabolism up will help clear out that anesthesia drug sooner than if you're just laying in bed.